What I found with our TikTok generation is when you bring up topics like health or law, it's like, it's boring. And we struggled for the first week. But what we decided to do was to bring the conversations closer to them. So I'm a millennial, but I'm not Gen Z. So sometimes I don't really get the TikTok dances or the trends or the memes, etc. So I invited my younger colleagues. I'm like, listen, we need to get this message across. And as we were able to do that, include them in the conversation, they were able to find mediums and platforms and memes and hashtags and etc. that was appealing to their generation and made them start to open up. So with our live sessions, we see people asking very important questions about their health, about SRH issues, and that was so important. My reason for this long story is when we want to change narratives, when we want to introduce a new topic to a generation that is so digitally inclined, you have to come to their level, you have to bring the information to their level. And that's why I'm so excited, because one of the main strengths that we have with media is edutainment. We have the power to inform and entertain. And there are so many opportunities with that, which we're going to be exploring today. I'm very happy that you're here with us. It is a very cozy setting, as you can see. There are drinks, there's food, everyone is approachable. So please feel free to ask a question. Please feel free to offer your feedback to the conversations that we'll be having here today. To further guide our events, I would invite Ota Akhigbe on stage to give more context. Please, a round of applause.
Hello, everyone. Good evening. Like she said, my name is Ota Akhigbe. I am the Director of Partnerships and Programs at eHealth Africa, and it's truly a genuine pleasure to be here in Nairobi, which is slowly becoming like a second home to me. I think I've been here about 4 times in the past few months. I want to start by appreciating each and every one of you seated in this room this evening. Yeah, it was. We've been here in this hotel the whole day. We're staying here. We're here for the summit earlier. And so we didn't really know much about what was going on outside. And then we started hearing there was a heavy rainfall and there was traffic. And I was wondering whether people were going to show up. So I'm very pleased and very appreciative that you all showed up. And I really do not take it for granted. Welcome. I'm grateful that it's going to be an interesting evening. For those who are unfamiliar, eHealth Africa is a non-profit organization that is operating programmatically in 29 across 29 African countries that we have. And we sit at the intersection of data, digitalization, and health. And we're part of the larger group of EHA Group, where we have the EHA clinics and the EHA Impact Ventures. It's such a pleasure to be here, and I want us to really quickly dive into the conversation. Mary had already given us some insight into what this evening is going to be like. But very quickly, I want us to start the evening, and I would like to invite 2 remarkable women. The reason why we started with the session we're going to have now is because it's important that we have the right data and insights regarding what we're going to be discussing this evening. We are all talking about edutainment. We talk about youth, adolescents. But we're inviting 2 women who are going to come and provide us with insights on this, so we see why edutainment is important. We see the power, the immense power that edutainment can drive in terms of behavior change in health, which is what we're really here for. The first is Dr. Christabel Garib of Population Council's Girls Center, which is a critical research organization. And the second is Bridget Dickon, the Managing Director of Shoe Jazz, and a truly impactful edutainment company based here in Kenya. So apologies, I wasn't looking at the screen. The picture that first came up is Bridget Dickon. So, in no particular order, since this came up first, Bridget, I'd like to invite you to come and give you a brief session on data and insights. Thank you.
The name of our company, Shoe Jazz, comes from the Swahili word mashja, which means heroes. Yes, we're an edutainment company, we are a mass media company, but essentially we tell the stories of everyday heroes. We believe that it is the young people themselves who have the solutions to the problems they face. And therefore, our organisation, Shugaz, is designed to really listen to young people to understand what are the barriers they're facing, what are the challenges that they're having around taking control of their future, and then to also find the young people who are finding a way to navigate those and heroes in our stories. So we tell stories that help them take control of their future. Now, there could be stories that build financial stability in an informal world. I mean, we're all aware that right now young people, well, all of us perhaps, but young people particularly, are really struggling to find a way to earn a decent living. So we find stories of young heroes who are navigating the informal economy and help them build skills in that space. We tell stories that help embed young people in every part of their community governance. It was actually in this very hotel a year ago when the Gen Z protests were happening. We were at a Gates Foundation convening, and we saw young people really trying to be heard, to raise their voices, to make a difference. And so we tell stories that can help people really feel that they are contributing to their community. Stories that help young people change and not just adapt, just thrive in a fast-changing climate. And the reason why we're here today, help them to take control of their physical, reproductive, and mental health. We tell our stories across multiple media platforms where we produce content every day. Most people who are sort of over the age of 24 know us through our comic books, which we've been producing for over 14 years. I see a few people nodding, it's always quite satisfying. We have events on the ground, we occasionally make TV and radio, and we have a continuous social media presence. But also, philosophy is to find young people where they are, to reach them where they are. And so I'm really excited to hear from the experts in the room who are finding a way to create tech that reaches young people. We've been quite unsuccessful in that in the past. Whenever we've come up with a solution, we seem to, or what we think is a solution to better reach and engage young people, they don't have space on their phone. They don't want to delete the few apps that they've already got. So I'm really looking forward to working out how to do that better. So I mentioned that we also tell stories to help young people take control of their financial health. So a while ago, we produced a comic book, and we've made a board game, or the idea of a board game that we put into the comic, and we taught people how to play, showed photographs of them playing it, our characters playing it. It was called Hella Hella. This is also Swahili Fumari. And said, here, give it a go and let us know how you get on with the game. And we got a message. All of our media is designed to get feedback. We receive thousands of SMSs a week and lots of social media content. And we got a message from this lady up in the top left there, Winnie, who has come to Nairobi from Busia looking to make money. And she was earning by selling one tray of boiled eggs to construction workers every day. And when she played the game in the comic, one of the tips was around value addition. So she added cashmere to the eggs she was selling. And she went from selling one tray of eggs to 3. And so she sent us a message and said, thank you, it was really great. So we went to meet her in the form of our fictional character, DKB, but our team went and met Winnie to hear her story. And when we were discussing with her about what advice would you give to other young people about how to earn money, one of the things she said, it's going really well for me. So one of the things I'm really careful to do is to have bulletproof. And what she meant was that she used a long-acting method of contraception and a condom when she was having sex, because she didn't want to jeopardize her plan. And that became our reproductive health strategy for about 2 years. We told the stories of young people who were earning a bit of money, and that one of those strategies that they were using was protection. And so we told Winnie's story across all of our different media touch points. She is the most powerful and compelling person to tell a story about reproductive health. Getting rid of that wagging NGO finger of you must do it and this is how you should behave. Yes, we tell stories on a national scale. Next slide. A huge amount of work that we do to tell these stories is brought to life by our network of super fans, 4,000 young people who are embedded in their communities. Again, going back to the storytelling, how do we tell our stories through the voices of young people? And I think that's the key. Reproductive health for us is just wanting to take control of your future, choose when to have a child. And if we can make people believe that they've got something to protect, then they will indeed. So that is the power of storytelling. Thank you very much. Apologies for the tech.
So I will now invite Dr. Crystal Oger to come and give us some research numbers.
My name is Dr. Crystal Oger. I am a postdoctoral researcher with the Fellowship Council's Girls Center based in Nairobi, Kenya. I undertake some research on adolescents' involvement in digital spaces that explains why I have interest in this event and even, in general, digital tech involvement of especially adolescents. So, just a quick introduction about my topic of research for this presentation. It's on inclusive digital SRHR for adolescents. So, essentially, as for council, we are trying to assess coverage of digital SRHR programming because there's a vast number of digital SRHR platforms, both globally and locally in Kenya. So we want to see how effective they are in measuring reach and coverage and how effective the information that is related to the adolescents is beneficial to them. So just introducing my organization, I come from the Population Council. The Population Council has 5 hubs. One of them is the Girl Center, the Girl Innovation Research and the Girl Innovation Research and Learning Center. So there we have 3 main missions. We generate evidence through conducting research. We communicate and convene such events where we, and disseminate the research findings. And then we also nurture talent. We have programs that, bring on board several key influencers in research and programming spaces. So the gaps in the literature include, lack of standard metrics because each and every digital SRHR platform is doing their thing, especially given the difference between global and local platforms.
Thank you so much. We are on a journey, and we also see the power of technology in engaging the youth. And for me, that's also a call to action that we need to find more ways to use technology to engage the youth. And then we see from the research presentation from Dr. Geru showing how they're assessing the coverage and the reach of digital SRHR platforms for adolescents.
Thank you very much, Ota. I'm just going to be a wallflower here because I think this session are some demos that are much more exciting than anything I have to say. So if I could just introduce the panelists who will come up. We'll start with Bridget Deacon, who we've already met, who was already presented. Bridget did a much better job than I can of introducing Shujats, and I've been well acquainted with the work they do. And what strikes me most is that they have created a network of youth that, through the sharing of information, knowledge, and resources, they help them gain control of their future. So, in the order of presentation of the other panelists, Jay Shapiro of the Secret Games is going to present. And the Secret Games, they are a studio enterprise, and they basically create engagement, particularly with youth, in ways that inspire action and positive change. And then after Jay has presented, he'll be followed by Brian Afambe of Black Rhino VR, and they're an extended reality tech company. And they that confluence of innovation, where through that they're able to innovate, create jobs, alleviate poverty, and address development challenges. So all these 3 companies are doing exciting things in this space, and I'm just going to hand over to Jay to kick off the presentation.
Thanks, Michael. If we can grab those slides. So as he said, my name is Jay Shapiro. I'm the chairperson of PAG, the Pan-Africa Gaming Group. We're the largest game developer in Africa with 9 studios around the continent. In Kenya, we have a studio called Usiku Games, as he said, which Usiku means night. And so I'm the founder of Usiku as well, so I have 2 hats on tonight. But tonight, I don't know what you were actually sort of expecting too much, but what I'm actually here to talk about tonight is, next slide, please, broccoli. Because we all love broccoli, right? I could go on for hours about how great broccoli is. But there's one really universal truth about broccoli that everybody, I think, probably can relate to, which is, next slide, please. If you give any youth anywhere, not just Africa, not just Kenya, the choice between broccoli or a chocolate bar, 97.3% of them, that's a real statistic, will choose the chocolate bar. And if I was a traditional NGO, I would run an intervention about the values of broccoli, and I would tell you that it's full of vitamins and fiber, and I would do a medical poster about the value of antioxidants, and we would have a street, activation, and maybe a football club we would get involved with, and all that kind of thing. And I guarantee you, at the end of it all, 96.8% would still choose the chocolate. That's kind of the reality, right? What we're all about as an organization, what Edutainment, I would argue, is all about, is we take the broccoli and we grind it up into little tiny pieces and we put it inside the chocolate. So they don't even realize they're getting the broccoli. And what they're choosing is the chocolate. And that's what we're all about. We create fun first, entertainment, games that people want to play without even realizing that they're learning as they do it. There you go. So that's a really cool, quick example of how we're blending gaming technology and AI. We have WhatsApp video calls that you can call an elder, for example, in agriculture, and talk to an elder and ask them questions about how to run your farm. But we're obviously doing with eHealth as well. And so there you go, 5 minutes. Thank you very much.
Thank you very much, Jay. And then could I ask Brian, a Black Rhino VR, to come on up?
So just FYI, I graduated from a very prestigious school, and it's called the Prestigious School of YouTube Premium. I studied XR online, and I convinced a bunch of about 17 people to join into the bandwagon, and we are what you call creative technologists. So I'll explain what that is. Cool. So no egos and just enjoy the slides. We decided to go and do something that was unthinkable. We created a design document. And the design document, over the years, our business model has been based on building content for international organizations, local companies, and of course, working extensively within the continent. So we had a dream one day, and we said we were going to build a platform. And this platform would allow young people to rapidly build and publish augmented reality without the need for code. Code is a huge barrier to entry for people because, number one, they might not have the patience to learn code. They might not have the intellect to learn code, or also the environment that can allow them to build code. So what we decided to do is we decided to venture into the unknown. And we created a design document. We didn't have the money to build this platform, but we spoke life into it, and we had a design document in my drawer for 3 years until there was a grant that came out. And this grant allowed us to actually build Africa's first, and not only, by the way, and I pray that it's not the first, it's not the only platform that allows young people to rapidly build augmented reality without the need for code. The backend uses something for computer vision, it uses artificial intelligence for image recognition, and then something called a GUI, which is a graphics user interface that people can be able to actually build AR without code. You guys, please, you don't understand how much headache augmented reality was until this platform. So our ethos around it is, it has an ecosystem. That there's cloud editor that you rapidly build. The AR, it's like PowerPoint on steroids, but with artificial intelligence and a GUI, right? And then you have to publish it through a mobile phone. Our campaign is called Arise Africa. I don't know for the discernment, you see what we did in the NR. Okay. Okay, cool. Anyway, so the campaign is called Analyze Africa, and the idea is each one, reach one, teach one. Tell any young person who wants to access these skills. The platform has been embedded with a learning management system that they can also be able to go through the whole AR journey from a macro perspective to understand globally what it is and application wise. So thank you so much for this opportunity. I really appreciate it.
One of the things that we do at Jazz all the time is talk to young people. We talk to them in focus group discussions, we online, and really and through surveys, and really listening to try and understand what's going on for young people and how can we cover the brocade in chocolate. So when it comes to motivators, what do you think is likely to have the biggest impact on girls' use of contraception? Income, friends, or education level? In a room like this, I'm thinking you'll all know the answer. But any votes for income? Any votes for friends? See the MGB sugar friends no. Any for education level? It is overwhelmingly friends. If you think your friend uses contraception, you don't have to know, but if you think she does, you are much more likely to use contraception. Whether is it about information or is and knowledge or access, or is actually about having a conversation with someone who really just wants to listen and hear. And able just to look at the data and really just kind of understand how can we better engage young people in the conversations that they want to have around protecting their future. So we're delighted with the developments in AI world that allows analog media producers like us to play a little bit in this space. So thank you for the opportunity to talk a little bit about that.
So thank you very much, Bridget. Thank you, Brian. Thank you, Joe. And Bridget, from my experience with Shujaz, you're not that far from the digital space. Because at the end of the day, you manage to connect with the youth. And since we talk about keywords, from Shujaz, what I'm hearing is conversations and listening. From Black Rhino VR, it's about empowerment so that people can address the issues that they're grappling in their daily life. And from Seal Games, it's about people gravitate towards what they like and what they enjoy, and that's how they learn without even knowing it. So thanks for all the exciting presentations and giving me a round of applause.
Michael is being modest. Please give Michael a round of applause. Thank you so much, Michael, for facilitating that demonstration session. And just like you said, I mean, we saw, from immersive gaming with the sickle, cutting edge VR, AR, Black Rhino, and then we saw compelling storytelling from Shujaz. Thank you so much. And we're now going into the final session for today, which is the panel discussion. And really, the reason why we positioned this as a final session, like I said, we're going on a journey. First of all, we started from seeing some research numbers and trends. Then also trying to see some practicalities with an edutainment company like Shujaz. And then seeing the demonstrations from these innovative companies just to see how they're using these innovations to deeply connect with youth and then also drive behavioral change in the youth. And now we have this conversation with some of our amazing partners, and the conversation really will just focus on their groundbreaking work, working with young people, working with adolescents and young people. We're also going to briefly learn from them. They'll share these on their lessons in leveraging technology to ignite behavioral change as far as this is concerned. So without further ado, and afterwards is when we will now open up the floor for questions and comments and a bit of engagement from the audience, and then we wrap it up and call it a day. So very quickly, I would like to invite Nelson Aseka, the co-founder and CEO of eHealth. Welcome, Nelson. Next up, I invite Enoch Musioka, the Strategic Partnerships Manager at Rich Digital Health. And then, of course, before I introduce the last but not the least, I want to apologize on behalf of two of our speakers. When I spoke earlier around appreciating each and every one of you for being here. Two of them were stuck in bad traffic and are not able to be here. But I would now invite my co-host, Meriadur, the Chief of Staff and Head of Strategy at BellaNaija. Welcome. So I would start very quickly with Nelson, and I would like you to just share with us how you are using AI and community engagement to support developmental organizations in driving measurable behavioral change in the last mile. And I would appreciate it if you could maybe spend 1 minute if you have any reflections to share from the demonstrations that we just saw. Thank you.
Yeah, so moving on into AI, I always want and have learned that I need to demystify AI when talking to crowd because, everyone thinks that it's this big giant robot lizard hybrid which is talking to the cities, yelling that I'm coming after your data or, coming after your jobs. Well, on the other hand, it's just a really confused intern with 10,000 tabs open trying to help you plan your next trip or trying to help you write an email or, make your work easier, faster, finish your work in time to go and spend time with your families and stuff. So it's really helpful rather than being, coming after your job, so to speak, in the way what I've been talking about it. So, and how I do this is through storytelling and, I hope I'll do it in the 5 minutes to tell you how we came about with influence and how it's impacting lives out here in Africa and even in Asia when we were working. So the idea influence came from a pub, as in it's that unique. Right? So back in 2011 when I was in my previous job, hawking alcohol, I was charged the responsibility of bringing a brand new whiskey into the Kenyan market. This whiskey was called Genesis, some of you know it. And when I was coming into the market with it, no one knew about it, as in it was an unknown drink, and there were two main big competitors that were already present in the market for over 25 years, so they had market dominance and all. So I decided first, before I do any activity, let me go and learn and understand who my target consumer is. So I spent a period of about 8 weeks just bar hopping, sitting in a corner every single day of the week and observing people, right? Or observe what time do they come to the bar, what part of the bar do they gravitate towards, who do they interact with, what do they order on different days of the week, different times of the month, just very small minor details that I kept on noting, and they really made a difference. So over the 8 weeks, I really, got a lot of data out of this. Some of it absolutely useless, like would be the first thing to cause effect, but sometimes that would help, and things like that. So. But the one thing that really stood out to me was that consumers trusted bartenders over everyone else. They trusted bartenders over their friends. When it came to drink suggestions, they would trust bartenders over, those ambassadors, brand ambassadors that would come promoting drinks to, the consumers. So I quickly decided that bartenders are going to be influencers. On the other hand, my competitors were using, the typical influencer would be, a socialite or a radio presenter and stuff to drive uptake of their drink. So I started the first bartenders club, and what I did every first Monday of the month to bring them together, hire a club, fill it up with Jameson, and then when they come in, because I used to collect a database of all these bartenders. So when they come in, first I'll do a 20 minutes brand immersion just to tell them what Jameson is, where it's from, how it's made, best way to drink it, stuff. And then after that, I let them party. Right? There's free drinks, free food, there's a DJ, stuff. So that went on In the morning, they'll go back home to their stations. They're so excited. They're like, oh, we had the best party with Jamison. And Jamison is really good. I didn't know the biscuits. So breaking it out to make them really understand. And you know what? Like every person, when you walk into a club, you trust the bartender what he'll look up and treat. So this bartender just, without knowing, this started becoming our ambassadors. We didn't tell them that you're going to become our influencer. Staff were just really just letting them have a good time, but giving them key information about what Jamison is. And over the time, you find that someone comes to the club and says, hey, what would you suggest I take for a drink with Blender? Using Jamison, it's better than what you used to because A, B, and C. Or someone says, could you make me a cocktail? Then bartender will and make your Jamison cocktail, because over that bartender parties had collected a database of about 5,000 tickets. So that meant I had 5,000 foots on the ground, right? Because at Jamison at that time was the company was just starting, and looking at the competitors, there are thousands of sales guys, marketing, things like that. So within 7 months, Jamison grew from 0 to the highest selling whiskey, and that was phenomenal, even for the company itself. So I was promoted into Africa to replicate what I'd done in Kenya, and I did that, and it worked over and over again. So in sitting down and thinking, I said, if I could put this strategy onto a tech platform, I could use it to grow any brand or grow any messaging anywhere in the world without, just using that same strategy, and it would work. And that's how I first came about, right? So we use what we call an audience first strategy, where we are able to target the end users, like the consumers that we're targeting with Jamison. On this hand, we're looking at it from the lens of social impact. So, for instance, during COVID times, we were looking at particular target consumers, not target consumers, sorry, putting it together with marketing, but target audiences or target populations. So we would say we are targeting people, let's say, in a particular county, and we would use our platform to identify these people, learn about them, get their behavioral insights and everything, and then we'll be able to identify people within these audiences who are trusted enough to be able to drive messaging that will drive behavior change. So that's how we really have used and turned around this technology to be able to drive social behavior change by identifying driving peer-to-peer conversations which are relatable to community members that help these community members take up that behavior change across the board. So that's how we've been using AI to drive change.
Thank you so much. Thank you, Nelson. Very simply, the power of community engagement to drive behavioral change. And that's an inspiring story you shared. I will go straight to Enoch. I know that Rich Digital Health has a chatbot platform, Chaticos, and I would like you to share with us the development and evaluation experience of Chaticos and where you see it going in this crucial space that we are. What next for Chaticos?
I just wanted to start from giving a little bit of comment and accolades the speakers who spoke earlier. I think eHealth Africa, you did a great job bringing all of us together, because one of the things that I was seeing was a common trend and a common thread. Just seeing the things that people are doing, things that different organizations have already tried. I think all of us, if we come together, which is something that you guys are trying to do, we would go far. Some of you guys are already trying chatbots. Some of you guys have already tried quote unquote analog ways of doing things. which actually makes sense because all of that can be sort of put into digital format. We could use AI to sort of accelerate some of what that is already being done. And of course, gamification, which is really resonates with the current youth that we have right now. So just kudos to the work that has already been done. Coming back to Chatikaz. Chatikaz is a WhatsApp-based platform that was designed by the youth for the youth in South Africa. And this particular chatbot was created to sort of navigate unhealthy behaviors that were leading to intimate partner violence. So how we started this was actually through a study that we did in South Africa, and we were trying to look at what ways can we actually make youth or young women at this particular point to understand that what is unhealthy behavior. How can I identify signs that my partner is is violent, or what behaviors are violent in this case? So we tried a few methods or ways of actually doing this. We had a control arm, of course, and then we had another one which a chatbot that we were just giving narrative. We were just, content was there, everyone was interacting with it, and we had another arm where we were using gamified approaches just to make sure that these people can actually, or these young people can actually interact with the chatbot in a gamified way, and to actually understand what the signs I should be looking at in my partner, just to look and see if there could be a chance that there is violence that is going to be involved, and how to actually, avert that. Who should I talk to? Who is the right person to actually engage with at what particular point? And we were giving like nudges at every single point, just based on certain key elements that we see within the chatbot. So on that, create something based on that, and try to have some solutions for that. So thank you.
Thank you so much, and actually super. Thank you. I mean, I'm glad to see that we have this platform, but that you have a methodology to monitor, to evaluate. It's very important for taking you in the direction that you need to go to. So thank you for sharing that. And apologies, I forgot to mention that you should share your insights on the demonstrations. So thank you for bringing that up. And I would move quickly to Mary. First of all, just like the other two, you could share your brief reflection, if any, on the demonstrations. And then I would like you to share with us what current trends are capturing the interest of young audiences, being a leading lifestyle organization with experience across Africa. And also share with us what you think motivates them. From what you're seeing, what do you believe motivates them? And we're currently in Kenya, so which of these trends do you think resonates with the Kenyan audience?
Thank you so much. I want to start by saying Africa gets bad press, and that's where majority of our issues stem from. My career spans digital media strategy, and over the years I've worked with numerous brands, numerous organizations. Some of the most exciting projects I've worked on are with a lot of trade and tourism boards, including Dubai Tourism, Italian Trade Agency. And I just came to the realization that Africa gets bad press. So while we speak a lot about innovation, we speak about tech, we speak about healthcare, we speak about youth, there's something that sometimes is always missing, or an afterthought, or the last thing that we say, oh, just the pictures of the videos. It's having a proper media strategy. Because I lead one of Africa's leading media platforms, I do see that a lot. And the fact is, we do need to strategically think about how we are telling our stories. I know we've said this so many times, but when we're running tech campaigns or healthcare campaigns, how often do we say, what's the media reach going to be? What are we investing? What's the budget that we're investing in media? Not just because we want the pretty pictures, well curated videos, but actually thinking about the story that we're putting out for the rest of the world, not just for Lagos or for Nairobi, but for the rest of the world. Building off of, I know I touched on this earlier when I was giving the introduction, was building what birthed this partnership with BellaNaija and eHealth Africa was our Women's Month campaign that we started off this year with. And I think one of the best parts of it was I love his story on the bartenders. And I was just thinking about how digital media helps to fast track that process and helps to reach farther, wider. So what we were able to do within the space of 4 weeks was poll over 12,000 women when it came to sexual reproductive health. And so that is one of the positives that digital media affords you. It affords you time, cost effectiveness, etc. So we found a lot of wonderful, and I like how we've been speaking with data-driven insights. All of the speakers have had data-backed insights on what they're working on, and it's very important. Something that was shared during the main summit was how, we there's been progress, but we still are lagging behind when it comes to having really curated, clear, accurate data about the African continent in terms of different industries and different sectors. We're doing well there, but we can do better. And I think this is where digital media comes in. So yes, there is a huge potential to capture the youth in these types of conversations, but we have to include them while we're thinking, while we're planning, while we're arranging, while we're doing all the big innovations. We have to include them and include our messaging in the way that is easily understandable by the African youth.
Thank you. Thank you so much. Thank you. In fact, when you talked about, when you mentioned that conferences like this may not necessarily, you know, be the most interesting to them, I actually realized that we did try to bring some actual very young people to be here today. But I mean, for a number of reasons, the timing and all of that was really difficult. But obviously, the feedback is taken, and like we all know, we have to involve them. They are the main characters in designing this thing. So thank you so much to the panelists. I will now turn to the audience, the very fantastic audience. Honestly, they have been, obviously, anybody who is still here now is just a rock star. Thank you for being here. We thought to take us all through the journey, the research, the edutainment, practicality, the demonstrations, and then the panel, and then take some questions and comments from the audience before we wrap this up. So I would now pause here for anyone who has any questions or comments or contributions. Thank you so much. Oh, fantastic. Hands are popping up, and I would need help with that. Thank you.
Thank you so much for a fabulous evening. I'm also a member of the J. Shapiro fan club. I'm grateful that he invited me. My name is Kabir, and I've been working in the health and education space for quite a while now. A couple of related comments and questions. The term wasn't used, but social and gender norms are really critical and key if we are to actually see.
We have to be realistic, and we have to understand that, yes, before they get to us, they have got to a lot of other places that they consider more fun. So really, which is why I like that you brought it up, and why we are having more of a collaborative mindset, understanding that no one party can do it alone, and the more we work together, the more we can get to where we need to go. So I would give the panelists, any of them that want to answer that question. But to speak about the first part, I like that you said that. And for me, when you were speaking, I think what was coming in my mind is technology, innovation, it's one thing, but social intelligence must work hand in hand with innovation and technology. And it's very important that we have that front and center. So thank you so much for that contribution and question. I don't know if any of our panelists, our demonstrators, our speakers, if anybody has any answer or comment in response to
I think very importantly what you said about us collaborating. So I think that's the first thing, just that inter-industry collaboration. The second important one, especially when we talked about uh, misinformation, is quantity and quality. Unfortunately, bad press goes far. That's just the unfortunate truth. But with more, and I'll give an example. So last year, I was part of a campaign called Harmony Her Power. So it was a campaign on women's economic power. And what we tried to do, of course, promoting women's economic power, but also demystifying women's economic empowerment as different from women's economic power. And if you go on Google, the first thing you once you put economic, you see empowerment. But we wanted to move away from empowerment to actual power, because power is when you have the agency versus empowerment. We all know the difference. So it was tricky to change that, and especially when the people were speaking. Not that it was negative news, but it was so tricky and so hard. But with quantity, we bombarded the media space with quantity of content, a lot of content about economic power. And in no time, we saw that even podcasts were talking about Nigeria, people were using it as title of their videos, they are oh get ready with me. So that quantity and quality of content is very important when you try to, push out this information.
Thank you so much. Yes, James.
Yeah, I mean, I think one of the most important elements is for reaching this generation, nobody here, right? Is authenticity and reaching them where they are. And this is part of why I like Shuka so much, because it truly is the youth voice, and it does reach them where they are. And we're talking about sexual reproductive health, through government regulations and religion. A lot of the organizations are actually quite prudish. But we need to recognize that if we're trying to reach sexually active young men, for example, they are sexually active. And they are going to the places where Kabir has said, right? And I can't speak firsthand, but I have heard that those websites have ads on them, right? And that you could run ads specifically for young men in Kenya who are going to Pornhub, right? And put your positive messaging alongside what they're already looking at, right? And so I think we just need to recognize the realities and get over.
I like your points that you brought up and about collaboration, and also the fact that I'm excited about setting up this consortium because we have different skill sets that are complementary to each other. Like for instance, us, influence, maybe Shujaz could a media tool that helps you amplify and reach as many people as possible, and impactfully so, and with measured kind of impact. But at the same time also, I think as we go ahead and keep on getting into this tech age, we are almost going to be losing out the underserved communities. Most of the guys who actually need this help are those guys who don't have access to data, they don't have access to phones. How do we reach them? So we need to be inclusive in a way where we can do that. So through our tools that we're developing, we're able to do last mile, to be able to reach underserved communities, to be able to drive this messaging to social behavior change that will reach that girl who's deep in, the rural area that does not have access to internet. So I think even as we do this, as we think about moving more digital, more tech, we still need to carry the underserved because those are the majority.
Thank you very much for this panel. It's the first time I've engaged in a forum like this. And I have a question, which I think, Joe, you might have spoken to just now. And it's around, so it's edutainment. So there's an element of educating. And from what I've heard so far, which is absolutely amazing, I feel, and it might be my own sort of filter that I'm receiving, there's more of a leaning towards women impact, how women are impacted in some way. So we'll talk about the sexual health, reproduction
space, I'm hearing a lot of women, then learning about contraception, etc. So my question is, how do we use this to also educate the boys and the men in equal measure so that we're not leaning too much, because it almost puts the burden of sexual reproductive health on the woman, but it takes two. So I'm just wondering, and I don't know, it might be that it's already there, but I didn't hear it so much. So that's my question. What's that leaning and balance between the two in that regard, if there's any?
Thank you. Thank you so much. So that's one question for Jay.
One question as well. Yeah. Sorry, I didn't expect this. I expected to discuss eHealth and technology, but it was amazing. I grew up playing a game called Clash of Clans, and I'm happy to see all this coming up, and I'm sure the future is bright. Again, you don't have to play a game by Supercell. But what Nelson talked about was really unique, and reading what Enoch does, probably he didn't speak about it, was also very unique. And that's what you're doing. I'm doing AI in healthcare, and we kind of put back the banner of AI because we realized we had infrastructural challenges. And this is common in our region. So you'll find, if I told my grandfather 20 years ago that he didn't need to go home physically, let's say Moranga, to take money home, would have thought I'm out of my mind. And you see, money transfer existed before M-Pesa. So what M-Pesa did is realize Africans were underbanked, and we needed to use what was existing. So that's what gave birth to mobile money transfer. So we did that with healthcare, realized hospitals don't keep data in the long term. So we developed an encryption technology that allows hospitals to encrypt data that was 1 GB to 1 MB. We allow radiologists to report medical images, to access medical images from devices from their phone, so they don't need to be at the hospital. So a hospital that was doing imaging once a week can do imaging the entire week. Patient has to wait 3-4 days for that result, doesn't have to wait so long. So Nelson came up with a very good strategy, especially when Jameson was coming up. And what we're finding very difficult is coming up with a strategy to sell on technology, because first of all, you're facing opposition from guys who think, oh, we're gonna take their work. Said do banks with M-Pesa. Today we look at the reduction of banking halls with courtesy of technology, mobile money. So I wanted to understand what are some of the strategies that they could share when it comes to reaching this market and such applications.
Thank you. What's your name?
Tom.
Thank you so much. What's your name?
Tino.
All right. So the panelists, please just, if it's possible, for 5 seconds to answer any question. Please.
So real quick, if someone should bring up a wonderful, and I'm sure they are, on educating the boy child on, these issues like SRH, I'll be very, very glad to front run it. What I've found is a lot of the times, because women, we're locked, we like to talk about issues that affect us, and that's where a lot of these campaigns come from. But I know definitely I would check and I'll share with you, but I know there's some very key campaigns that lean towards educating the boy child, when it comes to these issues. I know they exist. To your question about the last thing you mentioned, there's the data, with digital media, you can always track. So if you're saying, if I'm reporting that, we got 5 million, say, impressions or something from a particular campaign, it's because I can extract the data from that. And if it's a billboard, obviously I cannot extract that data from, you mentioned like the physical appearance or the physical interaction with something. I think that was your question. And tracking that, I can't track that. But when it comes to the digital part, it's much easier to track the data and get that. Thank you.
So around balance for men and women, I think for this particular context, getting towards talking about young. Or in our organization, we have different programs that are actually dealing with men, even small obsession, which mostly is associated with men and things like that. One thing about men also, we have a project that we're doing in Zanzibar with T-Tree. And one of the things that we're doing is it's for maternal and child health, but we're encouraging male participation. So even when you go to a facility, you get first dibs to see the doctor if you go with your partner. So some of those things are things we are adding around impact and measurement. We sometimes run full-fledged RCTs, and we try to also personalizations into some of the work that we are doing, so that you are also targeting individual people based on their particular need, as opposed to just sending push messaging which is generic to everyone. Yeah.
Thank you.
Yeah, very quickly also, I'll just go through this quick. So about involving men, that was actually a very interesting point, because we learned through our AI behavioral research that in some communities, women will not do something until they have the backing of their husband. So then we started involving husbands. Like we need to just, we are currently doing a second phase of a campaign in Kano, in Kaduna State, Nigeria, which is inclusive family planning for people with disabilities. And we're involving the husband in it. In the first phase of the campaign, we saw a 38% increase in people with disabilities seeking, family planning services in the centers, because they were being backed by their husband who are doing sessions together with them. So that was very important, and I think it's important to keep taking forward. And then moving quickly to the second one, Tom, you're asking about learning selling AI. We had the same problem as you. By first day, I would walk into a room and speak, and when I get out of the room, I leave people more confused when they got, because I'm talking about natural language processing, NLC and all that. So I just broke it down and started doing a simple story, which is the Jameson story, and it makes very much sense whenever you select someone can put themselves into the Jameson shoes, and they want to be that brand that grew from zero to the heights and wasting this. And then the second thing is that we identify people within those communities who understand the culture, they understand the nuances, the best way to relate to the community members, to actually pass the messaging in the best way they know how, through, of course, being guided by the framework that we give them in how to deliver this message. So that research and insight phase first is super important, and then using people who are relatable to the community and understand the nuances is also important. And then about attribution, we have a lot of attribution methods with our platforms. It could be like what in digital media, you can understand how much reach you make and things like that, the tools that we have. But there are others which we say, let's say we are driving people to certain health centers to take up services. We will work in the back end with the health centers to give maybe codes or things that the people who get this messaging from social media will go and present and believe. So we'll be able to say 50% the people who came on this day were driven from this particular campaign through the social media. That's just one of the examples. Sometimes you use microsites where we tell people to upload the receipt, and then we'll send you some data or something once you've taken that service, so we'll be able to attribute. So there's so many ways that we can attribute. And then the last one is about young people. How do we involve young people in creating these campaigns and stuff? Again, that research element is very important to understand what they're saying, what they're doing. And for us, what really helps us is the right feedback. If it's not a one-way communication, they have ways to get back to us and say what they're thinking, because we're using people that we relate with so they can drive conversation. And these people that we're using, the champions, will come back to us and say, my community members are saying this, these are the areas that I think we need to focus on and stuff. So we work with community members who co-create, especially the young people, to the best way to disseminate information.
Thank you so much. There's a round of applause for the panelists and for everyone who asked questions. Thank you so much. We appreciate you. Apologies, we couldn't take all the questions. I've received so many prompts. Just to say thank you so much for being here and being very present. Thank you for our incredible speakers and demonstrators. We are very excited to build on this momentum because I know that while Nelson was speaking earlier, he talked about the consortium that we are working on. And Timo asked a good question around how to involve the youth. So we're actively building a consortium to further develop some of these critical ideas and take them to scale. So we would welcome you if you would like to learn more about it, if you would like to support it, if you would like to invest in it, please reach out to us and we're very happy to engage with you. We truly do appreciate you and we're going to continue the conversation after here. Thank you so much.